welcome to my channel. Today I'm going something away from taking my regular classes to something called how to guess the question paper for anatomy students of first year BDS. Most of my subscribers from dental section had asked me to take this. Remember, few things. I follow BD Chaurasia. I think most of the people, 80% of the students follow BD Chaurasia. It's quite an easy book, sort of notes to anatomy. Remember, having work abroad, I know that even the foreigner students use BD Chaurasia. Number two, I'll tell you here what are the vital topics for dental students and why it's in future. Remember the question paper, myself having said question paper, I know something that they clearly tell us because we are setting the paper for dental students. So what are the important things for dental students which will meet them in second year, third year and their clinical life? In their prosthodontics, endodontics, maxillofacial surgery and other subjects which meet. So with the questions we train for them in the first year. Next, remember something, anatomy cannot be edited. You're seeing this video after 1 year, 2 year, it holds good. Anatomy can never be edited. The same thing repeats. Structures were present thousands of years ago. The same will be present even after 2000 years ago. They cannot be edited. Of course, physiology, biochemistry and other stuff, other subjects can be edited. New techniques are coming up in that. But ANAT cannot be edited. And speaking from you are learning this from a 14 years experienced person who has seen more than 29 to 36 academic year examinations. Let's now go for, I'm going from BD Chaurasia. I request you to hold the textbook. I'm not going into much details. I'm just going to tell you what is important, what can come for 10 marks, what can come for 5 marks, and what can come for 2 marks. Let's start. Keep your textbook ready, please. When you're seeing this video, keep this textbook ready. Let's go. In the last chapter, this head and neck chapter, that's for BDS students, the chapter is head and neck excluding brain and few things. First one is the osteology of head and neck. In this chapter, this holds good only for 2 marks, such as structures passing through different foraminas. Of course, you may get superior orbital fissure here for 5 marks, ramus of mandible for 5 marks. These are the few questions which may come. Of course, they may ask you, some typical questions may come to you of describe the first cervical vertebra, describe the hyoid bone, describe the maxilla. These are the things for you to need to concentrate in this. Nothing much. Okay, 2 marks question. This chapter number 1, holds good only for 2 marks question, rarely 5 marks question. The 5 marks question mainly comes from your mandible, maxilla, and maybe the hyoid bone or the vertebrae. That's very rare. The third and fourth, the vertebrae and the hyoid bone are rare. Let's go for the second chapter. Remember, second chapter is a vital chapter. When it's setting the paper, the scalp. This is only for 10 marks. Remember, scalp is for 10 marks question. It most of the times it has come for 10 marks, the first question. Because you people don't have any choice, so you need to write this. Read everything for scalp for 10 marks. And next, you have to know about the motor nerve supply of the face, the typical diagram what you are drawing in this chapter, the motor nerve supply of the face. It can come for 5 marks. Then also the sensory nerve supply of the face for 5 marks and the facial muscles. In facial muscles, just read orbicularis group, that is the oculi and the oris, the buccinator. These are the 2 important muscles for you people. Rest muscles I can just have a glance through. They may even come for 2 marks. This chapter also has certain questions, important questions here from the facial artery for 5 marks, very common. Facial vein for 5 marks, very common, including lacrimal apparatus, either 10 or 5. So this is it. This is the questions in this particular part. Remember, in this chapter, you have 10 marks, you have 5 marks and 2 marks. Any question which is asked for 5 marks can come for 2 marks also. Remember this important point. Next chapter for you to concentrate, side of the neck here, you'll come across everything. It's most importantly a 10 and a 5 mark question. In that, the first thing is deep cervical fascia. Read about it. And it has lots of layers. The carotid sheath can come for 5 marks and including the posterior triangle for 10 marks. The posterior triangle is for 10 marks, or they may ask you contents of posterior triangle for 5 marks. These are the questions of this particular chapter. And The last question here, nothing doing, sternocleidomastoid. Only for 5 marks. Very important question. In this chapter, the favorites will be the posterior triangle for 10, deep cervical fascia for 5, and including the carotid sheath for 5, and including your sternocleidomastoid for 5. Mostly 5 and 10. The only question here will be from the posterior triangle for 10 marks. The back of the neck is not that much important for dental students, but you can just have a glance through it. Nothing much comes in this, but you can just go through it. The muscles of the back and the suboccipital triangle. Never have been seen from past 10 years. I've never seen this question been asked. Maybe in your states it may come for this pattern. Next will be the contents of vertebral canal. As per the DCI syllabus, it's not given for you to concentrate so much on this. Of course, in physiology, we'll be studying about the dura mater, the CSF. So here, just have a glance through. Your +2 knowledge should help in this. Remember, vertebrals, and I'd go for next chapter, that is the vertebral system of veins here. I would concentrate not on the veins. I'll tell you the question is a vertebral artery, which will meet you in thyroid chapter. There I will talk to you about that. Next will be this cranial cavity, vital. Of course, dental students don't study about the brain, but they have to concentrate on the scale chapter. We have the dura mater for 2 marks of 5, cavernous sinus. Please concentrate this entire question for 10 marks. Hypophysis cerebri, the pituitary gland for 5 marks. Trigeminal ganglion. Please note, put a star here. This will meet the students in 2nd year, 3rd year, 4th year in maxillofacial and OMR, where you people have to know about the trigeminal neuralgia. So you need to start from this. This question is for 5 marks. And continuing with this, you have middle meningeal artery, and you have to know about it's for 5 marks. Of course, it comes under maxillary, but this you can read. If they don't ask maxillary artery for 10 marks, they may ask you middle meningeal artery for 5 marks. This one, concentrate in this. So the chapter number 6, concentrate. You have cavernous sinus for 10 marks, hypophysis cerebri for 5, trigeminal ganglion for 5, and the middle meningeal artery for 5 marks. Next, the contents of orbit. Yes, extraocular muscles, the favorite stock question for most of them. It can come for 10 marks here. Ciliary ganglion for 5 marks. Nothing else I would like to concentrate. Yes, some idiots may ask you ophthalmic artery or abducens nerve for 2 or 5 marks. So main question, if I am reading, I will first read extraocular muscles, everything. When I mean 10 marks, it includes everything. And then the ciliary ganglion. Next question will be the anterior, the 8th chapter, anterior triangle of the neck. Do not leave anything in this. Everything, one of the most important chapters. Here you can come across the infrahyoid muscles for 5 marks together. In the anterior triangle, they will just ask you nothing but the submental triangle. It's just for 2 marks. Submental is for 2 marks, but the digastric may come for 5, and carotid is a perfect 10 marks question. In that, if they don't ask carotid triangle, remember external carotid artery for 5 marks. Your common carotid artery for 5 marks may come, including the branches of it. This chapter, you need to concentrate about 10 marks and 5 marks. This is it. Next chapter, no need to talk. Parotid, very important in future dental students. Concentrate everything in this. Everything. I don't want you to leave anything. I will not say parotid gland, everything. If they don't ask parotid gland, they may ask you relations of parotid gland. They may ask you the nerve supply of parotid gland and parotid capsule. And they will ask you about this thing. And next, this is one of the favorite questions. Name the cranial nerves in order. Describe in detail the ANAT, the root of the entire course of the facial nerve for 10 marks. Parotid gland chapter 2, 10 marks. Parotid gland and facial nerve. No leaving anything, nothing doing. Facial nerve, 10 marks. Read everything from the start to the end, applied aspects. Next, perhaps dentistry's atrium is this one. Temporal and infratemporal fossa. Again, I'm putting the big arrow here. Do not leave anything. Muscles of mastication, 10 marks. Otherwise, 5 marks. To burn you for 2 marks. Maxillary artery, favorite stock question for 5 or 10 marks. Most probably, the first is for 10 marks and then for 5. Or name the branches of maxillary artery for 2. TMJ, please. The only joint dental student study is a TMJ. Do not leave anything in that. Starting from 2nd year, from the TMJ articulator to prosthetics department, this joint is vital for you. There are separate textbooks for you for this thing. TMJ, read it for 10 marks. Everything in there. If they don't ask TMJ, get ready for articular disc for 5 marks. The muscles and movements of TMJ for 5 marks. Relations of for TMJ, 5 marks. Next, mandibular nerve. No need to talk about anything about this for 10 marks. Otic ganglion for 5 marks. As you have concentrate temporal and infratemporal fossa, go for submandibular region, everything. So you have three salivary glands. You studied parotid gland for 10 marks, submandibular for 10 marks, suprahyoid for 5, that is suprahyoid muscles, and sublingual gland, okay, for to just have a glance for it, just for 2 marks or 5 maybe, and the ganglion. The question may come to you, describe in detail the anatomy of submandibular salivary gland, add a note on the ganglion, this part. So 5 marks is this one. Next, deep structures of neck. This is quite a little bit out of the topic for a thing here. I need to jump a little bit. Thyroid gland, stock question for 10 marks. Parathyroid for 5 marks. Thymus, irritatingly, come for 5 marks. Skip a little bit. I've told you about the common carotid artery and the external carotid artery, so I'll not go into that. Yes, you may go for the next thing, that will be the glossopharyngeal nerve. Very important for dental students. 10 marks. Skip vagus now, unless someone kills you here. Skip accessory nerve, except the spinal cord, sorry, the sternocleidomastoid is supplied by this one. Hypoglossal, concentrate for 10 marks. If they don't ask facial or mandibular or glossopharyngeal, get ready with hypoglossal for 10 marks. And then cervical plexus. Most of the students ignore this. MBBS students will study brachial plexus, lumbosacral plexus, coccygeal plexus. Cervical plexus, please concentrate for 5 marks. Just hiding behind the sternocleidomastoid, it's going to come for you for 5 marks. Ignore trachea, ignore esophagus, lymph nodes of head and neck, 5 or 2 marks. And then just jump to styloid apparatus. It's for 100% stock question for 5 marks. It's a very important question, styloid apparatus. Then here in the prevertebral region, only concentrate on the joints of the neck, that is the atlanto-occipital and the atlanto-axial, together may come for 5 marks. Mouth and pharynx, you are studying DADH, so I will not talk much about this here. The questions may have come, I have seen from experience. So here many questions coming from the mouth and soft palate. It's a development of tooth. It's not here, but I am just giving you development of tooth may come for 5 marks. Yes, you may have DADH after the exam after 2 days. That is next day physiology, biochemistry, and then DADH. But this question may come. So read about development of tooth and go. Soft palate 10 marks. Passavant's ridge 5 marks. And pharynx 10 marks. Everything in this, don't. And this superb question, Walde's lymphatic ring, concentrate 5 marks. If they don't ask pharynx, they would ask this. Palatine tonsil for 5 marks. And Killian's Desians, a favorite question for 5 marks. This question, these are the stock questions in this. I'm going slow, please. I'm just writing and everything here. Don't think I'm going very fast or something. Next, nose and paranasal. Yes, here nasal cavity for 5 marks, nasal septum for 5 marks, lateral wall of nose 10 marks. Please remember everything in that. I need to write conchia and meatus. Read for 10 marks, lateral wall of nose. And dentistry's second most important chapter, perhaps after the temporal infratemporal region, will be your paranasal acidosis. Read for 10 marks. Of course, give a full concentration on, if they don't ask paranasal for 10 marks, then expect maxillary sphenoidal for 5 and 5. Of course, at model and frontal may come for 2 marks in this region. And here also concentrate on this fossa, the pterygopalatine for 5 marks, maxi nerve for 10 marks, and pterygopalatine ganglion, the ganglion of this one for 5 marks. If sometimes the question paper, the examiner knows that you may have studied all these dental important questions and the examiner pretends to not ask this, the question will be from larynx. Larynx, even though it's important for dental, it sometimes comes for 10 marks, but commonly asked everything. If they don't ask larynx, get ready for muscles of larynx or ligaments of larynx or cartilages of larynx. Each can come for 5 marks. And movements of vocal folds, expect favorite question for 5 marks here. Like you concentrate TMJ and everything, now just you need to concentrate on tongue. Everything. No leaving anything, no bunking in this. If tongue is 100% 10 marks question, if it is not asked, let's get ready for muscles of the tongue, that is 5 marks. Papillae of tongue, 5 marks. Nerve supply of tongue, 5 marks. These are all the questions which may come. Or sometimes to just irritate you and ask you to write more thing, dorsum of tongue for 5 marks. Ear, just concentrate only on tympanic membrane for 5 marks. Middle ear, please do not leave middle ear. Leave everything. Don't leave middle ear. Everything in middle ear. I need you to tell me the boundaries, the ossicles, and what happens, how does it function, why its lubrisamol is a gun, and so thing. And internal ear, just concentrate what is not given here. Organ of Corti for 2 marks. That's it, please. That's it. There's nothing for you eyeball. There's nothing for you in the brain. CSF, maybe some idiots may ask these questions. This is it for the DCI. I've gone exactly DCI syllabus. And the person who's speaking is just having almost 11 years of experience in a dental college and together 14 years teaching anatomy. So please remember, I know this job by reverse. Trust me, I may go wrong here and there. Every human does blunders, but this is how I prepare this for you. And remember, question paper may come to you in different characteristics. They may ask you the 10 2 marks question and 5 marks question and 2 marks question. It's how it works in Karnataka. But in your states, it may be 10 marks and 5 marks and 3 marks. Remember, write everything for 10 marks. You do not leave anything. You write less, we cannot give you marks for 10 marks. And for 5 marks, you need to add at least. Remember, they carry more marks. If you have choice, in Karnataka you don't get choice, but if you have choice, you need to use the choice properly. I hope this topic helps you and helps you to pass the exams. I'm releasing this video in the month of April 21st, so I hope you people can go through the exams which are coming up very soon for the academic year. All the best. Please, if you have any questions, always feel free to ask me to this email, Dr. the Dr. _ JAHANZEB @hotmail.com. Dr. _ JAHANZEB @hotmail.com. Please share my video with your friends, in your class group, in your WhatsApp group. Some may feel bored, some may feel at least one student gets benefit from this. It will help a lot for him. Thank you. Do subscribe. Bye-bye. Before I forget something here, of course, the paper will have gross anatomy plus one compulsory embryo question, such as your development of palate, development of face, cleft palate, cleft lip, that thing, and histology, 1 5-mark question as per your syllabus. Histology of bone, histology of bladder, anything. So 5 and 5 marks question, compulsory, 1 from embryo and 1 from the histology. Thank you. Bye-bye.